acute necrotizing ulcerative gingivitis. It also known as trench mouth, and it is a severe form of gingivitis. It is characterized by the following conditions: painful, bleeding gums, ulceration, foul breath. Let's know about etiology of acute necrotizing ulcerative gingivitis. Bacterial infection, weakened immune systems, poor oral hygiene, high stress, malnutrition. Symptoms are severe pain in gums, bleeding, and formation of ulcers. Treatment for ANUG is deep cleaning, antibiotics, and oral rinses to manage infection and alleviate symptoms. Improving oral hygiene practices and addressing underlying risk factors are crucial to prevent recurrence.